Acne vulgaris. What is acne vulgaris? Acne vulgaris is a long-term skin condition that occurs when your pores get clogged with oil and dead skin cells. This can form pimples, redness and swelling, which most commonly appears on the face, the upper back and the chest. Acne vulgaris is also known as just acne or pimples. In this video, we'll be looking into what causes acne. What are the different types of acne? We'll look at the symptoms of acne and how it's diagnosed. I'll also go through how acne is treated and some tips on how to care for your skin if you have acne. So make sure you stay tuned for the full video. If you're new here, I'm a medical doctor, and I make weekly medical education videos to help you become more medically knowledgeable. If you're interested, make sure you subscribe to get notified each week when I upload a new video. So what causes acne? Well, there are 4 main factors that cause acne. The first factor is excess sebum production. Sebum is an oily substance produced by your skin that can clog up your pores if it's overproduced. This happens because of an increase in the amount of androgens, which are male hormones. These hormones stimulate the sebaceous glands in the skin to produce more sebum. However, it isn't only men who have these hormones. Women also produce androgens, but they produce them in much lower amounts. But during puberty, pregnancy and menopause, women's androgen levels increase, and therefore so does their risk of developing acne. The second factor in the development of acne is dead skin cells. Normally, skin cells die and drop off the skin surface, but sometimes they can build up and clog your pores. This can happen because of an increase in the production of keratin. Keratin is a protein found in the skin, hair, and nails. And although it's important for protecting the body from the outside environment, too much of it can cause problems, particularly if you have acne. The third factor in the development of acne is bacteria. Normally, our skin has a balance of good and bad bacteria, but when this balance is disrupted, it can lead to acne. One of the main types of bacteria that can cause acne is called Propionibacterium acnes, also known as P. acnes. This type of bacteria normally lives in hair follicles, but when it multiplies rapidly, it can cause inflammation and lead to acne. And finally, the fourth factor in the development of acne is inflammation. When the body becomes inflamed, it releases chemicals that can cause the oil glands to produce more sebum, which can then lead to clogged pores and acne. Inflammation can be caused by a number of factors, including stress, hormones, and certain medications. Now let's take a look at the different types of acne. There are several different types of acne, but the 4 most common ones are open comedones, closed comedones, papules, and pustules. Open comedones are also known as blackheads. They appear as open sores on the skin with a black or dark center. This is caused by a buildup of sebum and dead skin cells in the pores. Closed comedones are also known as whiteheads. They appear as closed sores on the skin with a white or light center. This is caused by a buildup of sebum and dead skin cells under the skin. Papules are red, swollen bumps that can be tender to the touch. They're caused by inflammation of the oil glands and hair follicles. And pustules are similar to papules, but they have a white or yellow center, which is a collection of pus. They're caused by a bacterial infection of the oil glands and hair follicles. So what are the signs and symptoms of acne? Well, acne can cause a number of different physical changes to your skin, including pimples, redness, and swelling. Acne can also cause psychological distress, such as low self-esteem and anxiety. And this is because acne can be disfiguring, and it can affect the way that you look. This can lead to social and work-related problems. Now, in terms of diagnosing acne, well, acne is usually diagnosed clinically based on the appearance of the skin. A healthcare professional will ask you about the type of acne that you have, how long you've had it for, and any treatments you've tried. They'll also ask about your medical history and any medications you're taking. Sometimes a skin swab may be taken to identify any underlying bacterial infections. And this is particularly relevant if you have severe acne. So how is acne treated? Well, treatment for acne will depend on the severity of the acne and may involve one or more of the following options. Firstly, there are topical treatments, which are creams or gels that are applied directly to the skin. These can help to unclog pores, reduce inflammation, and kill bacteria. Examples of topical treatments include adapalene, a retinoid, and clindamycin, which is an antibiotic. Secondly, there are oral treatments, which are medications that are taken by mouth. These can help to reduce sebum production, unclog pores, and reduce inflammation. Examples of oral treatments include isotretinoin, which is a type of retinoid, and antibiotics such as doxycycline. And thirdly, there is phototherapy, which uses different types of light to treat acne. This can help to kill bacteria, reduce inflammation, and unclog pores. An example of phototherapy is blue light therapy. There are also some tips that you can follow to help care for your skin if you have acne. Firstly, cleanse your face twice a day with a gentle cleanser. This can help to remove excess oil and dirt from your skin. Make sure you don't over-cleanse your skin though, as this can dry out your skin and make acne worse. Secondly, use a moisturizer suitable for acne-prone skin. This can help to hydrate your skin without clogging your pores. Look for oil-free and non-comedogenic products, meaning they won't block your pores. Thirdly, wear sunscreen with an SPF of at least 30 every day. This can help to prevent sun damage and reduce inflammation. Acne can make your skin more sensitive to the sun, so it's important to protect it from harmful UV rays. Fourthly, avoid touching your face. This can spread bacteria and make acne worse. Try to keep your hands away from your face as much as possible. And finally, don't pick or squeeze your pimples. This can cause scarring and make acne worse. It can be tempting to try to remove pimples yourself, but it's best to leave this to the professionals. So what's the outlook for someone with acne vulgaris? Well, most people with acne will experience some degree of improvement over time. However, for some people, acne can be persistent and may require ongoing treatment. With the right treatment and skincare, most people with acne can achieve clear skin. It's important to be patient and consistent with treatment, as it can take several months to see results. So what are the complications of acne? Well, acne can cause a number of complications, both physical and psychological. Firstly, scarring is a common complication of acne. This can occur when the body tries to repair damaged skin tissue and can result in raised or depressed scars. Secondly, another complication of acne is skin discoloration. This can occur when the skin around a pimple becomes darker or lighter than the surrounding skin. Thirdly, acne can also cause eye problems, such as dry eyes and blepharitis. Blepharitis is a type of eye inflammation that affects the eyelids. And finally, acne can also cause social and psychological problems, such as low self-esteem, anxiety, and depression. This is because acne can be disfiguring and it can affect the way that you look. This can lead to social and work-related problems. So what are the red flags to look out for? Red flags are signs or symptoms that indicate a condition is serious and may require urgent medical attention. In the case of acne, there are a few red flags to look out for. Firstly, if you notice any changes in your skin, such as new or unusual lesions, it's important to get these checked out by a healthcare professional as soon as possible. This is because they could be something else, something more serious, like skin cancer. Secondly, if your acne is causing you significant distress, such as low self-esteem or anxiety, it's important to seek help from a mental health professional. Acne can have a significant impact on your mental health, and it's important to get the support you need to manage this. And finally, if your acne is not responding to treatment, it's important to speak to your healthcare professional. They may be able to adjust your treatment plan or refer you to a specialist for further treatment. So what did we learn today? Today we learned about acne vulgaris, what it is, what causes it, the different types of acne, as well as some of the signs and symptoms to look out for. We also looked at how acne is diagnosed and treated, as well as some tips on how to care for your skin if you have acne. If you enjoyed this video, make sure you check out my other videos on various medical topics. And if you found this video useful, please leave a like and comment below. I always appreciate your feedback. Thank you so much for watching, and I hope you learned something useful. Take care and stay healthy.